Everybody, this is Dr. Elzik again, and the surgery today is a finger replacement or a joint arthroplasty. We're going to do the middle joint of the finger here. It's called the proximal interphalangeal joint. And to do this surgery, you make a zigzag type of incision called a Brunner incision directly over the joint, as you can see drawn over here. So you see here the finger exposed, and you can see the flexor digitorum profundus tendon. And what I'm going to do here is this layer here, this is the pulley system. And so in order to get our full exposure, we're going to need to divide this A3 pulley here, just longitudinally down the middle. And in doing so, we'll be able to expose the joint surface. You can see here we have the joint surface exposed fully, and you can see the arthritis, the wearing away of the cartilage on this surface. It's very severe. We have the tendons here retracted out of the way, and you can kind of see the other part of the joint too. See the crater that the arthritis created. It's a very severe arthritis here and wearing away of the cartilage. You can see this is the arthritic surface, and what you do is you essentially take this part away and you get rid of the arthritis and make a nice flat even surface for our implant. So right here you can see me broaching the canal to make space for the implant. See this is where the stem will fit down the canal of the proximal phalanx. So you see here we have our instrumentation for the joint replacement. This joint replacement is called a Swanson joint replacement. It's made by a company named Wright Medical, and it's been around for over 40 years. It has a very good track record, and it's what I use for all my joint replacements. Now the size in this particular patient that we're going to use is a size 2. And we always make sure to trial it first. So I'll show you how to do the trial right now. Our Swanson trial implant right here. And it has a directionality to it. The shorter end always goes distal and the longer end always goes proximal. And essentially we have our canals prepared as well for the implants. So we're going to put the trial in here. And you want to use a smooth tip forceps for this part so you don't damage the trial. And then you're going to take the finger through a range of motion. You're going to see how well it does. It actually tends to fit quite well. It doesn't seem too tight. And she has a brand new finger joint. So here we have our final implant by Wright Medical, the Swanson silicone implant. You can see it's clear silicone. And we take it, and just like the trial, we're going to put it in and make sure that it fits appropriately. Again, using a smooth tip forceps. So here we have our final implant in. It's hard to tell because it's clear, but it's right down in there. And I'm very happy with the motion that she has. This patient is going to do well. So we're now going to close the volar plate over the exposure in order to provide stability for the implant.